Okay, we are going to start. It's 2 p.m. Hello, good afternoon, everyone, and thank you for joining us today in our fourth webinar for this year's NLAAD campaign. My name is Luis Mares, Director of Community Mobilization at the Latino Commission on AIDS, and today's webinar is about the invisible crisis, HIV and AIDS, among Hispanic Latinos in the United States. This webinar will be recorded, and later we will post it in our social media and our webpage. We will also share the link of the recording and a PDF version of the presentation by email to everyone attending this webinar. Let's remember today is October 15th. It's National Latinx AIDS Awareness Day, a time to remember all those we have lost to this epidemic, a time to strengthen our efforts to create awareness among our community and communicate information on the importance of screening and prevention, as well as of treatment and retention in care. Living with HIV or not, we are all fighting this together. Remember as well to visit our website, www.nlaad.org, and check out the events happening today and also the following days by clicking on the events here in the menu of the main page that we have. This will lead you to this page where you can see a list of events, and in this picture you can see only the 3 first ones. But today, just today, we have 36 events happening around the country. If you are near one of them, please support the event, share the information, share on your social media about the event so more people can attend it. Also, finally, before getting into the webinar, for those who are in New York City, today under the NLAAD umbrella, we are having Take the Train, Take the Test, promoting HIV tests and screening in and near our subway system. Several organizations from New York City have organized this event together, and hopefully maybe the following years it could happen in different cities around the country. Let's work on that. So now our presenters today are Dr. Vincent Guillermo Ramos and Rosie Mora. Vincent Guillermo Ramos is a professor at the Silver School of Social Work, New York University, and director of the Center for Latino Adolescent and Family Health. In addition, he is a nurse practitioner with the Adolescent AIDS Program at the Children's Hospital at Montefiore. Dr. Guillermo Ramos is an expert on the role of Latino families in promoting adolescent health with a special focus on preventing HIV and AIDS, sexual transmitted infections, and unplanned pregnancies. At Montefiore, Dr. Guillermo Ramos provides primary care to adolescents living with HIV, PrEP for high-risk youth, and screening and treatment of sexually transmitted diseases. He will present about the crisis among Latinos and HIV. And Rosie Mora is a native Houstonian from Houston. She moved to New York City to become a National Urban Fellow. This intense program for mid-career professionals presented her with the opportunity to graduate from the Mark School of Public and International Affairs with a Master's in Public Administration. During her fellowship, she served as the HIV administrator for Coney Island Hospital, where she learned and understood the importance of HIV testing and linkage to care. Now, in her new role of Director of Community Health Education, she is leading the efforts to develop a national agenda that will focus on national health issues that are affecting the Latinx community. She will share information about this new initiative the Commission on AIDS is leading, the organization of the National Hispanic Latinx Health Leadership Summit that will happen in February 2020 in Washington, D.C. So with this, Vincent, you can start sharing your screen. Vincent?
I'm here. I'm sharing my screen.
Yeah, share your screen.
Are you able to see that?
No. Yeah. Now we can.
Okay.
Perfect.
So thank you very much. I guess I'll start by I just want to take a second to thank the Latino Commission on AIDS, especially Luis Mares. I think, Luis, you've been a phenomenal leader in organizing this. And so I thank you very much for the invitation to be on the webinar today. I also want to thank all the folks that are on the call because of your interest and commitment to supporting National Latinx HIV AIDS awareness. And I want to acknowledge Rosie. Rosie, I'm really looking forward to presenting today with you. And I think that at the end of the presentation, Rosie's going to be sharing, I think, some really exciting work that is going on that will sort of make some of the themes that I'm going to be discussing sort of actionable and things that actually will sort of lead to next steps. I'm going to be talking about what a number of us have called the invisible crisis among Latinx communities in the United States. And I'm going to actually try to sort of get my ideas across with four ideas. So Luis, it's not advancing. Luis?
You have the controls, Vincent.
It's not advancing on the PowerPoint.
In the lower part of your slide, there's arrows.
I see. Thank you. I got it. Thank you. Okay.
Okay.
So I'm going to actually do four things. First, going to provide an overview of the HIV/AIDS epidemic and sort of give an update on where we are nationally in terms of responding to the epidemic. I'm going to go through our national strategy and really highlight the Ending the Epidemic initiative as it relates to Latinx communities. I'll spend some time talking about underlying drivers. And I think probably the most exciting part of the webinar, in my view, is really discussing community mobilization efforts and some recommendations for addressing HIV disparities among Latinx communities in the United States. So I want to start by acknowledging that we've actually made, as a country, lots of progress. And so by no means do I want to suggest that we haven't had much success. I think if you look at this slide, you can see that since the 1980s, there's been more than 60% reduction in estimated HIV incidence. And you can see that in many ways we are on course to actually end the epidemic in the US. I think what also sort of warrants attention is that despite all of the progress that we've made, there are some communities, and Latinx being one of them, that actually is experiencing an increase. And so you can see here on the slide, from 2012 to 2016, the annual new diagnoses among African Americans, whites, and overall in the US decreased, but for Latinx, it increased by 7%. And if you look at estimated annual new infections, you can see the same basic pattern for the overall US, African Americans and whites, reductions, and a significant increase, 14%, for Latinx. The epidemic is concentrated in very specific geographic hotspots. And so you can see here, in terms of HIV diagnoses among Latinx, there are 7 states in Puerto Rico that account for 8 in 10 of the new HIV diagnoses among Latinx. But it's also important to acknowledge that despite there being very specific geographic hotspots, that actually there's some interesting data that comes from the CDC about sort of high transmission clusters. And these high transmission clusters are actually on networks where HIV is being transmitted at a much more rapid rate than what one would expect. And these are not solely concentrated in the areas that in my previous slide I highlighted, but in fact, they're actually throughout the United States. And this is important because when one sort of looks at the transmission cluster, and you can see here in this slide that a transmission cluster is sort of a group, a network, where transmission can be as high as 33 times the national average. And so in the CDC molecular surveillance, you can see that the rates range from 5 to 33 times. But one would expect, on the left side of the screen, you can see one would expect HIV transmission to actually occur at a much lower rate. But in these rapid transmission clusters, we see many more individuals becoming infected than what would be sort of the natural course of HIV transmission. What's important about this and how this relates to what we're talking about today is that when you look at who is represented inside of these transmission clusters, you see a couple of important sort of patterns. One is you see in rapid growth clusters, clusters that are actually growing, that about 40% are Latinx. You can see here that in terms of rapid growth clusters and transmission categories, that MSM overwhelmingly represent individuals who are represented in the rapid growth clusters. And you can see at the very bottom that under the age of 30, and so Latino, MSM, younger than age 30 are disproportionately represented in the transmission clusters. These trends are best understood by considering the specific Hispanic Latino populations that are most heavily affected. And so I want to spend some time talking about, again, who is most affected. And so you can see on this slide that you have different sort of age distributions. And so these are new diagnoses among Latinx by age group. And you can see that that orange color is 13 to 29. You can see 40% of the new HIV diagnoses among Latinx are in that age group. You can see 30 to 44, and then you can see above the age of 45. And so when you look at transmission categories, again, the same basic pattern of what we just presented and talked about, you can see that MSM overwhelmingly represent new diagnoses. And so we're talking about Latino, MSM in particular, but not exclusively, but certainly overrepresented. And we're also talking about populations that are fairly young, 13 to 29 and 30 to 44. You can see here, just to kind of magnify that point a little bit more, that here new HIV diagnoses among Latinx youth, and this is the change in annual new HIV diagnoses among youth ages 13 to 24, and you can see the time period from 2011 to 2016, and you can see for US youth overall, for African American and white youth, reductions, but for Latinx youth, there was a 9% increase. And so again, just highlighting the importance of sort of the invisible epidemic among Latinx communities, particularly MSM, particularly young people of Latino descent, and not only in the sort of geographic hotspots, but also across the country in the high transmission clusters. This is the same basic point, but you can see here a change in the estimated annual new HIV infections among MSM. And it really is just, again, zooming in and highlighting that for the most part, we've had either sort of a status neutral. So if you look, for example, at African American MSM versus white MSM, where there's been a reduction, overall in the US, MSM have had 2% increase. But if you look at Latinx MSM, you can see a 30% increase, or you can see in the 25 to 34, a 68% increase in the estimated annual new HIV infections. And this is the change in the estimated annual new HIV infections. So transgender Latinas in the US, the sort of estimated 1 in 4 estimated to be living with HIV. You can see here that recent Latinx immigrants, based on sort of the most recent data, 1 in 3 Latinx newly diagnosed with HIV was born outside the continental US. I think what's interesting to note is that based on available data, it suggests that the majority of foreign-born Latinx living with HIV acquired HIV in the US. Some of the sort of takeaway points that I want to highlight, I think that it is true that we've had much success, and I think that definitely warrants recognition. And I am in no way suggesting that we should have diminished enthusiasm for ending the epidemic in the national plan. But I think it's important to also acknowledge that despite our progress, that there's been sort of increases in HIV incidence, and new diagnoses are sort of certainly increasing among Latinx. And that this is primarily driven by diagnoses among MSM, Latinx MSM, and youth. And so this is a way of saying that we need to make what's happening in Latinx communities more visible, much more of a priority, and that nationally a focus on the Latinx community warrants greater attention. I'm going to talk a little bit about ending the epidemic, and I think we all know that we have sort of a new plan that was in February of this past year was launched, and it's actually a very ambitious but very good plan to reduce HIV infections. And you can see here that 75% of new HIV infections in 5 years, and at least 90% reduction in 10 years. And so what's important is that we have these key strategies And I won't review these. I think probably most of us have heard of these key strategies, but what I would like to do is spend a little time talking about these key strategies in relation to Latinx community. And so when you think about sort of diagnosing people living with HIV as early as possible after infection, you can see here that about half of all Latinx have never tested for HIV. And you can see here that about 17%, or 1 in 5 of HIV positive Latinx are unaware of their status. And when you think about sort of the reasons for why people may not have tested, you can see here 1 in 3 Latinx ages 15 to 44 report never having been offered an HIV test as the main reason for their never testing. In terms of the second pillar, you can see that a big part of the national strategy is protecting people at risk, and that dissemination or uptake of PrEP, which is a very efficacious tool for preventing HIV infections, is suboptimal in terms of reaching Latinx. You can see here that when PrEP is actually taken as prescribed, that it's greater than 90% effective. I think what's also true is when we think about the estimated new infections, that disproportionately, as we've been saying on the call, that communities of color, for our purposes today, the Latinx community is overly represented in terms of new infections. But when you look at PrEP users and PrEP uptake, you can see that disproportionately PrEP uptake has been among sort of folks that would not identify as persons of color. And that's not to say that there hasn't been tremendous increases in PrEP uptake for Latinx and other communities of color, but it's still the case that overwhelmingly PrEP users are white, and it's also the case that overwhelmingly new infections are occurring among communities of color. You can see here, again, building on this Latinx theme, that Latinx account for 1 in 4 new HIV infections, but only 1 in 8 PrEP users. You can see, and this is actually something that just a couple of days ago, the CDC released a report, and it sort of struck me as interesting, and so I wanted to include it on the webinar today. And so in this very recent report, the CDC showed data that unprotected sex had declined among Latinx MSM. And so the definition of unprotected sex was defined as sex where the individual did not use a barrier method like condoms or PrEP, or ideally PrEP, and also a condom. And so the definition that's being applied here is where there's been some sort of anal intercourse without either a condom or PrEP. And so what's striking is that there actually have been sort of decreases among Latinx MSM. If you look from 2014 to 2017, unprotected anal sex. And so that actually is pretty terrific, and that's an improvement. But what's also interesting is that we've just laid out in the previous part of the webinar that there have been sort of new infections, and that new infections among Latinx MSM have actually increased. So for me, that raises some important questions. And I think some of the questions that we should think about is, well, I guess the most obvious is, how do we understand the increases in HIV infections among Latinx MSM, given the reductions in unprotected sex as defined by the CDC report that I've just highlighted? I think that some of the immediate things that come to mind are, what is the optimal percent or coverage of PrEP that we need at the population level for Latinx MSM to sort of be what is that sort of percent of coverage that we need in order to have a population effect for Latino MSM, in order to have the optimal benefits of PrEP? And then also, what is sort of the role of PrEP persistence, and really not just someone reporting that in the previous 12 months they've actually been on PrEP, but the important role of folks being on PrEP and actually staying on PrEP in ways that would protect them during times of risk. And then also, within the context of PrEP, what is the role of correct and consistent condom use? And is there sort of a very important role for correct and consistent condom use within sort of PrEP rollout and uptake? I think another sort of pillar of our sort of national strategy is for individuals living with HIV to really rapidly identify those individuals, but also to ensure once they're identified and diagnosed that they are in care and that they achieve sustained viral suppression. You can see here, again, data that comes from the CDC that roughly 50% of Latinx who are living with HIV achieve viral suppression. And again, I'm not making statements here about sustained viral suppression, which I think actually is what we need. But this is really at last HIV test achieving, last viral load test achieving viral suppression. You know, I think here it's important to, you know, sort of acknowledge that our goal is sustained viral suppression. I've actually mentioned this already, but I think that what's critical is that many people, when they actually achieve viral suppression, may not maintain their viral suppression. So we have to focus more heavily on helping Latinx not only to achieve, but also to maintain viral suppression. There's been lots of progress in terms of reducing stigma and the importance of U equals U as helping to end the epidemic. I think there's sort of compelling evidence that folks that are undetectable, that it's very unlikely, if not impossible, that they will in fact transmit HIV to other individuals. It's also important because, and this is sometimes, I think, I don't hear this as much in some of the discussion around U equals U, but I think it's very important. I know some of my colleagues would agree with me, but you know, really treatment was intended initially to keep people alive. And so I think it has the dual purpose of keeping people alive, of helping them to be healthy, but also it has a purpose of really reducing transmission. Again, U equals U for Latinx communities only is sort of a winning concept if we can help people to achieve viral suppression and maintain their viral suppression. I want to talk a little bit about the workforce because I think this is an important lens to sort of think about our national strategy. If you look at the US Latinx population, roughly about 18% of the overall population. If we look across at HIV care providers, whether they be physicians or nurse practitioners or physician assistants, but other kinds of providers, social workers, registered nurses, you can see that across the examples that I provided on the screen that were well below the actual need. And so this is an area that we also will need to pay attention to. If we are going to end the epidemic in Latinx communities, we will need to have a workforce that is responsive to the Latinx community. The second section, I think it's great that we've got a federal plan. I think the updated plan in February 2019 to end the epidemic by 2030 is very important and I believe actually achievable goal. However, in order to achieve the goal, it's going to mean that we need to focus in on where the disparities are. And I hope that I thus far have been pretty sort of compelling in terms of highlighting that the Latinx community warrants more attention, and that we'll need to think about how the key strategies actually align with the Latinx community. And I think that there needs to be some attention to the underlying drivers of the HIV epidemic among the Latinx community. And so I'm going to talk about the underlying drivers. I'm going to talk about some of the sort of contextual and structural barriers. And I think I'm going to highlight not all of them, but some of the ones that I think are sort of most important as I think about my own thoughts and the thoughts of folks that I've had the sort of pleasure of working with. And, you know, as we've talked about sort of what is really sort of driving the epidemic. So first and foremost, I think the invisibility of the Latinx community in regards to the HIV epidemic. It may be that there's sort of more traction at this moment, and we hope certainly, probably the majority of us on this call, if not all of us, and many more who are not on the call, that there'll be greater attention to the Latinx community in regards to HIV and AIDS. But I don't think that it's unfair to say that in many ways there hasn't been enough attention on the Latinx community. And this doesn't in any way take away or minimize the importance of our brothers and sisters who are overly sort of disproportionately impacted in other communities. But I think it's important to acknowledge that we need more focus on what's happening among the Latinx community. I think political climate and HIV criminalization laws, I'll talk about that in the subsequent slides. And actually, rather than go through each of these points, maybe I should go forward and maybe make my comments there. And so, one important point that I think I've mentioned is that for the most part, the crisis among the Latinx community remains largely invisible. This is a recent story that was written in The Guardian that really, really tried to create some media attention around the invisible epidemic, particularly as it relates to young people and Latino MSM. But it's not the case that there's enough attention on this issue, and we need much more. I think there are sort of current policies, and there's a context where Latinx experience their civil liberties being eroded, and that erosion actually has important implications for access to health and social services. And if you look on the left, these are data that are coming from Pew. You can see that in a recent study, a poll, Hispanics say their situation in the U.S. has deteriorated in the past year. And if you look on the right, you can see here that Latinx, LGBT, or lesbian, gay, bisexual, transgender youth experience discrimination due to their sexual orientation or gender identity. And so again, very large segments of the Latino community indicating that the context has become worse for them. Criminalization laws, I think, again, often don't reflect the current science. They don't reflect U equals U. Criminalization pretty much makes things harder for people to access the prevention and treatment that they need. And usually where there's more sort of negative or harsh laws regarding HIV, we see sort of more poor outcomes. And so again, this is a good exemplar of something that needs to change. Inequity of life opportunities. Latinx most at risk for HIV are most likely to be impacted by economic, health, social, and political inequalities, and that this sort of limited sort of opportunity, it affects sort of HIV disparities, and we see it sort of manifested there. The network, we've talked about this, but again, if there's sort of communities that have high community viral load, and if someone is making decisions regarding sex or drug behavior, and the community has a high prevalence of HIV, particularly acute HIV infection or very high viremia, then it becomes much more easy. It's much more efficient for transmission to occur. And so we need to think about the networks in which Latinx are making decisions regarding sex and drugs and how that contributes to disparities. Lack of access to health and social services. I think that we know this, Latinx are most likely to be uninsured or underinsured. And you can see here that, Latinx, like many people, are best served when we have really a comprehensive response from our health and social welfare system. And so we need folks to be able to access through, having insurance and having access to a health system. The sort of lack of culturally appropriate services, I laid out in one of the previous slides, the workforce issues, but even if the workforce isn't represented by Latinx community, certainly our workforce should be culturally competent and able to deliver services to Latinx community. And so cultural competence is associated with better outcomes. It increases adherence. It also improves overall health behaviors and clinical outcomes, and the actual patient or the individuals that are receiving the services feel better and more satisfied about their services. I'm not going to say much about the resource that I've highlighted here, but there is an interesting HRSA sort of funded project that really looked at culturally appropriate engagement of Latinos to enhance linkage or retention in HIV care. And we provided the link. It's free of charge, and it's certainly something that I would invite folks to consider viewing. Stigma, internalized stigma. Again, 9 in 10 Latinx living with HIV reported internalized HIV-related stigma. Stigma can stop people from being able to access the prevention and treatment that they need. It's something that we need to reduce and that we need to better understand how it serves as a sort of an environmental constraint to, sort of people getting the prevention and treatment that is needed. Intersectional discrimination, and so again, this is really an effort to try to bring together not only sexual orientation, but gender identity, race, ethnicity. I think it's important that when Latinx feel discriminated against, much like anyone who feels discriminated against, that creates mistrust in the actual systems that are designed to provide prevention and treatment. And so if there's mistrust of the healthcare system, this is going to lead to decreased utilization of services and suboptimal HIV prevention and treatment outcomes. I think that it's also important to acknowledge that oftentimes there may be differences in terms of health literacy in navigating systems of care. And so some of what we might be seeing in terms of inadequate testing and linkage and retention has to do with differences in terms of being able to exert self-efficacy or knowledge in actually mobilizing the healthcare system in ways that are responsive to Latinx needs. I'm going to actually transition to community mobilization and talk about some of the work that has gone on in mobilizing the community to address the disparities that I've laid out in the webinar. And so I want to start off by recognizing that this is not reflective of my work. I'm actually part of a much larger group that is really headed by some key organizations, including the Latino Commission on AIDS and Guillermo Chacon, also the Valley AIDS Council and Oscar Lopez, Bienestar in Los Angeles and Roberto Contreras, as well as representatives from Puerto Rico, from Kauai, from Florida, and I could go on and on. But I think what's important here is that there's more than 100 Latinx health and social service organizations that have been convening nationwide to really build sort of a community consensus process. And I think for the past year and a half, maybe closer to 2 years, we've been thinking about how could we best mobilize in ways that would be more responsive to the epidemic. And part of what that process led to was 4 broad recommendations, and you can see them depicted here on the screen, and I'm going to talk briefly about each one. But the 4 involve stigma reduction, prevention and treatment, specific research that targets the Hispanic Latino community, and then also greater community engagement. And so I think the first recommendation, as I mentioned, really has to do with reducing stigma in the Hispanic Latino community about HIV. And so that really is much broader than some of the key populations that I've highlighted. It includes the key populations, but actually includes the entire Latinx community, and really making HIV prevention and treatment something that is much more sort of acceptable, much more talked about, less shame, and sort of a reduction in stigma as a major barrier to folks being able to access the prevention and treatment that is needed. Increasing availability and accessibility of prevention and treatment. And so again, being able to specifically target Hispanic and Latinos who are most in need. And I think we have some insights from the slides about the most in need in the Latinx community, but making sure that prevention is available and that it's also accessible. So that means looking, for example, at policies that maybe prevent young people from accessing PrEP without their parents' permission, or ensuring that ARVs are affordable and that people have access to care, and that that care is available in the geographic context where it's most needed. And so again, at the backbone of our national strategy, we need to make sure that that the actual tools are available to Latinx and that they're able to access them. Increasing targeted funding for Hispanic Latino HIV research. And so, I think that there has been a sort of a focused effort to sort of target communities of color, and that's actually been terrific. But I think it's important to acknowledge that within communities of color, that Hispanic and Latino, as one community that requires and is very much in need of prioritization, warrants attention. And so we need specific research that is targeting the Latinx community and that is helping to develop sort of gaps and better understand the gaps in terms of, why is this incidence actually increasing? And I don't think we have clarity on that. I think that's a question. And so I think we need research that will help us to better understand that. Engaging diverse Hispanic, Latino community leaders and stakeholders. And again, I think the focus here is really on broad engagement, not just sort of the usual actors. I think it's great that more than 100 Latinx health and social service organizations have been meeting to address this issue, but we actually need partnership and support from everyone. We need folks to understand that in order for us to leverage the terrific tools in the national plan in ways that will sort of end the epidemic for all communities, including Latinx, we need, broad engagement. And certainly, we would ask that Hispanic, Latino community leaders and stakeholders sort of be at the head of that, but we need help from everyone. So why does any of this matter in terms of the United States, and why should we care? Well, we should care because Latinx are the largest and youngest racial ethnic minority group in the US. And so today, roughly 1 in 5 people in the US are Latinx. The US Latinx population is projected to double in size by 2060, and more than half of US Latinx are younger than 30 years of age. And by 2060, which, believe it or not, is not that far off, 1 in 4 people in the US will be Latinx. The future of the United States will be heavily, heavily shaped by the Latinx community, and what happens to the Latinx community actually will have a big impact on the overall health and well-being of the United States. I'm going to spend just a couple of minutes, if I can, playing a brief animated video that will do a really nice job in a couple of minutes of really laying out what I have talked about on the webinar today. And then I'll come back and wrap up, and we'll hear from Rosie, who will talk a little bit about next steps and what we can do. Can you hear that?
No.
I'm not sure why that's not playing, but I guess maybe we'll make it available, Luis, because it should be playing. I'm not sure why it's not.
It is. No.
Trends are best understood by considering the specific recent.
Can you hear that now?
I can hear it, but I don't see it.
Let's see if I can get this to go up now.
Okay.
Let's try it again. No, I think, Luis, I'm going to move forward because I don't think it's going to work. It doesn't appear to be working from the screen, but we'll make sure that the link is available. The video is online and it's very brief. It kind of states, the story of what I've been sharing on the webinar today, and I think it does so in a pretty effective way. So please check it out. It's called Invisible Crisis. I'm going to wrap up by just acknowledging the National Latinx Conference on HIV, HCV, and Substance Use Disorder. This is organized by Valley AIDS Council. I think Oscar Lopez and his group have done a tremendous job. Can you guys see this?
Yes, we can.
Okay, great. At organizing this national conference each year, it's gotten stronger and stronger. It's actually an amazing conference. And this year it will be, or this upcoming year will be in Albuquerque, New Mexico from April 3rd to 5th. And then the resources, I want to just wrap up by just highlighting that the Invisible Crisis video is here. And so this will be sent out and posted on the website. But you can watch the animated video as well as some interesting infographics and a marketing packet that we sent out prior to the webinar that you should have, and then also the webinar that I mentioned around culturally competent care. So with that, I'm going to wrap up and turn it over to Rosie.
Thank you very much, Vincent. Just give me a second. Sure. We have already some questions that we will address at the end of this presentation. So here Rosie goes. Welcome, Rosie.
Hello, good afternoon. Thank you so much, Dr. Guillermo Ramos, for that very informative presentation. I will watch that video. I recommend everyone else too. So I'm Rosie Mota. I'm here with the Latino Commission on AIDS in New York. I want to talk a little bit about the summit and what it is and how it started. But first, I'm going to go over a brief history. This has been in the works for almost 2 years. It was triggered by a CDC report stating the number of incidences, or the high number of incidences of new HIV diagnosis amongst the Latinx community. So the Hispanic Health Network took the initiative to draft a letter and also to brainstorm on how to strategize and how to bring focus this epidemic among the Latinx communities. So a decision was made by the coalition to have a call to action letter sent to the CDC, specifically to the Division of HIV/AIDS Prevention, Dr. Eugene McCrae. Then from there, a decision was made to develop a national steering committee and a planning committee. Out of these committees, it emerged that it was important to establish a national health policy agenda, which led to a summit, which will happen in early 2020. Please keep up to date with us. Keep the lookout for updates for the future of the dates that are going to be coming out soon. Next is where we are now. This month, we started convening 10 work groups. These work groups are focusing on prevention, mental health, immigration and migration, substance use, access to care, the South, research and data, which Dr. Guillermo Ramos is the chair, along with Dr. Miguel Laboy, and the HIV Epidemic 2030, Puerto Rico, and Stigma. And by the way, you still have the opportunity to join if you, as an individual or an organization, want to be a part of these work groups, or also sign on to the call to action letter that was sent in 2018. Please email me. My email is rmota@latinoaids.org. And by the way, today at 3 o'clock Eastern Time is the Puerto Rico work group. It's the first one. And for the groups that have already happened, there is a second call happening in November. And please, we will keep everyone up to date on the dates for the summit. But if you want to participate, have your voice heard, please email me. And we're also having a foro en español, all in Spanish, debrief, and giving the opportunity for those who prefer Spanish to have their input for the National Summit. It'll be on October 31st. And thank you so much.
Thank you very much, Rosie, for sharing this important information with our partners. What's going to happen with the summit in February in Washington, D.C. We hope to see a lot of you there to discuss what we're going to do about how to address health problems in our community. So we're going to go now to the questions. I see some questions here. First, for Vincent, Logan Anderson asks, do these MSM statistics include trans men? You got a question, Vincent?
I have the question. So I guess the question from Logan is, do the statistics include trans men? And so
Yep.
No, the statistics that we presented are actually Latinx MSM who are not trans, and then also we presented some data on transgender Latina females. I would say, Logan, that there is a sort of a scarcity of data specifically in relation to sort of transgender males. And so obviously that's something that we need to do a better job at. And I think for the purposes of the webinar, I was trying to synthesize the available data, but I would argue that you're absolutely correct, that we need to have better data that captures sort of the full, sort of all the communities that are vulnerable and that may be experiencing sort of disproportionate HIV. I would say that what warrants sort of attention is that if you look at the basic profile of the epidemic that we presented in the first section, the vast majority of the infections among Latinx MSM. And so I think that's also another important part of, how we should be thinking about what we were talking about today.
And as a follow-up to that question, I think it's very much related. Stephanie Espada asked, why do you believe that if trans men are unrepresented?
Why do I think they're overrepresented? I'm sorry, Luis.
Underrepresented.
Oh, why are they underrepresented? I think there's probably a number of reasons. I think that, obviously your sexual orientation and your gender identity are not the same. And so I think that it is definitely the case that somebody could be a trans man and also, be someone who identifies as gay or have sex with other male partners. I think that I think it's a data problem. I don't really have a good explanation because I myself, Stephanie and Logan, have also often been perplexed by this. I think that, the simple answer or the not so simple answer is if we don't have data on something, then it's clearly easier for it to not be a problem. And so I would argue that we need better data and that we need to be able to more accurately capture where there's vulnerability. And I would be 150% in support of the sentiments of both of those questions.
Thank you. Do you have any data in regards to the effect of anti-immigrant sentiment and actions of this administration on Latinx testing and health services?
Luis, that wasn't very clear. I think the question was about...
About data in regards to the effect of the anti-immigrant sentiment and action of this administration about accessing tests and health services for our Latin community.
So I think that there is some research, and I think there was a paper that I can make available if there's interest. And if you have interest, feel free to email me. But there was a great paper, I believe it was in the New England Journal of Medicine, that really captured, or it may have been in the Lancet HIV, that really looked at immigration and sort of migratory, sort of issues around migration and migratory sort of populations, and the impact of what's happening currently in the country in regards to people being able to access HIV prevention and treatment. And so we can send that out. I will give a plug for Omar Martinez, who I believe was the lead author on that paper. He's from the School of Social Work at Temple and actually is a lawyer and also has a master's in public health. I think he's a terrific colleague and certainly has written about this. I also will acknowledge touching base. Hopefully this isn't putting anyone on the spot, but I think some of our terrific colleagues down at Valley AIDS along the border, like Oscar Lopez, Peter Coronado, and some of the folks that are there, they are working sort of front line on this issue and really are grappling with sort of the border and issues regarding folks being able to access prevention and treatment. I would also reach out to them. But if anybody wants that resource, Luis, I'd be happy to provide it. I think it's a good summary and it lays out some of the issues.
Because you send me the link, I can send it by email when I send the PDF version of this presentation and the link to the recording that we're doing. So we will share everything. Great.
Absolutely.
So Gabriela Betancourt asked, Vincent, can you speak more about important considerations when we consider the younger side of the 13-29 spectrum, like 18, 13 years old, for example, and the intersection of being young, LGBTQ, Latinx, and first generation or generation 1.5 here in the States, and may not be here with the US, in the US with your family?
So Gabriela, you're asking me a lot of things in that question, and they're all topics that I care very much about. And so I think what I would say is that often when we think about our national strategy in relation to adolescents and young adults, I think that a lot of the focus has tended to be with a lens towards adult populations. And so I think I'm going to say AYA, adolescents, young adults, get lost in the aggregate data. And so I think your question, for me, it's tapping into how are adolescents and young adults different? I think they're different in many ways. I think starting with brain development and really recognizing that young people into their sort of early mid-20s don't have full connectivity in terms of their sort of prefrontal cortex and sort of linking the rational parts of their brain with the emotional parts. I think in terms of the development of their identities, the primary task of adolescence is really to figure out who you are and to grow up to be a healthy and have a positive sense of self identity. And I think when you are grappling with issues regarding homophobia, transphobia, HIV, what it means to be a brown person or a Black person in this context, if you're poor, if you're underinsured, if you don't have insurance, if you come from a family where members of your family may not be documented, maybe you're not documented, and all the different ways that I think our very diverse Latino community experiences its day-to-day life. I think those things have a profound impact on adolescents, and that they shape, one of the major tasks of adolescents and young adults. And that complicates the HIV prevention and treatment cascade. And I think what I would say as a way of really driving home the point, and I really appreciate the question, Gabriela, is that we need to spend more time thinking about what makes adolescents and young adults different. And I think that if you look at guidelines, if you look at strategies, there often is too little attention to the kinds of things that I think your question is asking for all of us to consider.
Thank you, Vincent. There's more questions. Patrick Dinwiddie, he said, in Washington, one of our populations of focus in our Department of Health supported testing programs is foreign-born Latinos, due to data showing many being late to diagnosis and care. Is your suggestion that targeted testing should be more focused among at-risk Latinx at large?
So I think, I think it was Patrick was the name. So Patrick from Washington, D.C., thank you for your question. I think there's sort of two parts to that question. So one of them has to do with testing. I think we actually need new ways of testing and new strategies. I think that a lot of the times our organizations are trying to do outreach to those that are living with HIV that maybe that are not yet diagnosed. And I think oftentimes we're testing, but we're not getting new HIV positives. And so I think we should pause and think, what are the strategies that we're going to be able to identify sort of new positives? And, I don't have the full answer to this, but I have some thoughts that I'm happy to share. I think that we need to continue to think about sort of looking at sort of the partners of people who are living with HIV. If we have a particular Latino person who is living with HIV, and if they have a partner, I think sort of testing partners or having an index and a partner is a smart strategy. I think folks who are on PrEP and may be inconsistent or may not be taking PrEP as prescribed, I think that's another opportunity for thinking through where there might be, new infections. I think for folks on PrEP, there could be clear vulnerability because of sort of a perception that one is protected. There may be reductions in condom use, and also there may be, potentially more sexual partners, potentially. And so I think it's important to look at folks who may be on PrEP but aren't persistently or consistently on PrEP, and that represents an opportunity for thinking about identification of new positives. Hopefully we're doing a better job at keeping people on PrEP and so that we can prevent that. But I do think that there hasn't been enough attention on PrEP persistence. I also would say that in these, I think the CDC is doing some exciting work on these sort of high transmission clusters and really looking at rapid transmission events and trying to very quickly use molecular surveillance to identify new positives. I think that's also very exciting. And then I think all the things that we normally do, but we should consider whether or not those things are yielding new positives. And if they're not, then I would say we need to be more focused in trying to reach the folks that that are living with HIV but are not being identified.
Thank you. A question from Nakia Outland. Do you find that it's a concern with prevention engagement because at many of these organizations, the staff is not a representation of Latinx communities?
I think that's a great question, and I would say that, in all honesty, I think it's a mix of a number of things. I think that often, for whatever reason, Latinx community is the largest ethnic racial minority group in the country, and we are exponentially growing. And really, what's driving our growth is fertility, birth. The vast majority of Latinos are born in the U.S., and a very large proportion of the Latinx community is young and is the future of the United States, as I mentioned in the webinar. But for some reason, we haven't been able to leverage sort of our collective voice, and we haven't been able to leverage our adequate share of the sort of health and social services and overall attention that we warrant as a community. And so I would say that it's still the case that at all levels of organizations, we need Latinx to be represented. So that doesn't only mean the staff, but it means in the leadership, it means at all levels. And we need to figure out collectively, all of us, how we can, right in our own settings, be more outspoken about this invisible crisis, and also about how to make the Latinx community, the health and social service needs, more palpable. We have to really get the attention of the key decision makers to make this a priority.
There are two questions that I think you can answer together. One is a follow-up question from Logan Anderson. I'm thinking that he's following up with his first question about trans men. Do we know of active research gathering this data about the effects in trans men, I think? And Alberto Piedra asked, what is the game plan to develop the data that we are missing on populations that are disproportionately impacted by HIV?
So I don't know if I have the game plan. I don't think that was, I wish, guys, that I had a game plan for collecting that data. I think those are questions that are better probably answered by the folks that actually collect the data. And so I think that we have national organizations that do that surveillance work. I think that what we can probably do, and I think Rosie did a wonderful job at highlighting the opportunities that we are working on this summit. And at the summit, I think that's a great opportunity to highlight in the report where we need additional data. The work group that I'm working on with Dr. Miguel Munoz-Lavoy, we are the research work group, and we're very interested in having participants join us and be active members of our committee. If this is something that you feel strongly about, that we need to have that data, then we would certainly welcome your participation, and we would be very committed to getting that perspective into the report, with the idea that perhaps collectively we can leverage the key stakeholders that are charged with getting that data and monitoring that to actually collect that data. And so I know that may not be a satisfactory answer, but unfortunately I'm not the person that is responsible for collecting all that data.
Ana Quesada Fritz asks, I find it hard to reach to the Latino community. I have been trying to get people tested, but the stigma is still here. How can I reach to Latinos and break the stigma?
So I think we need novel approaches to reaching Latinos. And I think, again, we can borrow from models where there's been great success. And so I would ask you to reach out to, organizations that have been very successful, Latino Commission, Bien Estad, Valley AIDS. These are organizations that have done really well at being able to engage the Latino community. I would also say that look at sort of delivery mechanisms that have been shown in literature to be really effective at reaching Latino community. And so again, in my own work here in New York, I've done a lot of community outreach through family engagement and really trying to involve key populations, but by making it really a community issue and a family issue, and that it's something that Latino families should be addressing. And that's been, in my experience, very successful. But I think there are some good exemplars, Fritz, around the country of folks that have done this very, very well. So I would invite you to contact Latino Commission and other organizations and actually maybe seek some guidance. There's some capacity building initiatives that I know are going on around the country in regards to this request. And I would maybe ask you to maybe try to connect with some of those folks.
Ana Quesada, I think the person, no, this is Soraya from Kauai, Puerto Rico. Does the CDC have any info or statistics that implicate Puerto Rico's trans community or Puerto Rican trans people living in the U.S.? How can we access it?
So I think that there are reports from the CDC. All that stuff is on the webpage. And so I don't know if the data is so clear regarding the trans community in Puerto Rico. I'm not certain of that, but I am happy to take a look at that and I can follow up on that. But I would, Luis, I'll commit to making available the actual sources that are embedded in the slides. And so on each of the slides, I'm referencing a report that comes from the CDC or some other source. And I think it would make sense for folks to be able to easily see that data. And, you know, obviously, Puerto Rico is one of the key areas that we need to target and that needs support. And I think there are things that are very specific to Puerto Rico that actually geographically make Puerto Rico sort of experience enhanced vulnerability. And so again, I want to give a plug for Rosie's work group. I think right after this call is the Puerto Rico work group for the National Summit. And I think there are people there that are going to be specifically talking about Puerto Rico that may be able to be a better source of information. I also want to mention that Jose Molinelli from Kauai, he's another great resource for maybe trying to reach out and see if he has that data or if he might be able to assist in terms of, you know, directing folks to Puerto Rico specific data.
And one last question because of the time frame. In the recommendations, I noticed that there is, this is from Jesus Casado. I noticed that there is no focus on training for health providers to understand the immigrant experience, particularly in understanding that many immigrants come from countries where there are no sexual health services or systems like the ones in the US, which impact the way in which immigrants try to seek services in this country. If they have never heard of PrEP or other HIV-related services, it's likely that they won't be interested in engaging. Are there ways in which these trainings are integrated into professional development opportunities for providers?
So I think that's a great question, Jesus, and thank you. It's a great question to end on. I want to maybe just take a step back and say that in the presentation, I was trying to convey on the workforce slide that there's a discrepancy between what is needed in terms of actual individuals who are Latinx in our country and the actual workforce. And so it's not just the numbers of healthcare providers that are Latinx, but it's also ensuring that those that are Latinx and those that are not Latinx are culturally competent in their care. Jesus, take a look at the webinar materials that are linked to this presentation that are really a separate topic, but very much related, that are about cultural competency. And I think that that HRSA-funded project was really designed to address what you're referencing and really building capacity. But you're right, we need providers to not just learn the technical aspects of sort of medicine and healthcare in their training programs, but there needs to be a much greater focus on the interpersonal aspects and a lot of what makes the technical pieces work, which means being able to engage, being able to respect, being able to have cultural humility, and being able to understand people with similar as well as different experiences. And so thanks for the question.
And thank you, everybody. With this, we finished the webinar today. We have another webinar coming up in 2 more days, very important, about the plan to end HIV in the country. I hope you join us. And thank you, everybody, for being here this afternoon. Thank you, Vincent, very much. Thank you, Rosie, and goodbye, everybody.
Thank you, Luis. Bye-bye.